Hi, how are you? How are you doing? Welcome to the fifth episode of According to Ways. I'm Wesley, and today we're talking about a sector where technology meets our humanity most intimately, and that is healthcare. Can artificial intelligence diagnose malaria better than a human eye? Can it predict disease outbreaks in rural Uganda? So, in this episode, we going to examine how AI is transforming healthcare across the continent, from university labs to remote health posts, while we are also unpacking ethical risks and the infrastructural gaps that still hold us back. In Uganda, like many African nations, we face a double burden. We have a high prevalence of infectious diseases like malaria and HIV, alongside a rising tide of non communicable diseases like cancer or diabetes. This is also compounded by a chronic shortage of healthcare workers. While the World Health Organization recommends a doctor to patient ratio of 1 to 1,000, there have been estimates from recent years that have placed the ratio in Uganda as high as one doctor for every 25,000 people. This means overworked nurses, long queues, and a system that is heavily reliant on paper based records. Now, the question is, can AI help leap these hurdles? And if so, at what cost? So, why healthcare needs AI in Africa? AI promises, in this context, with anonymous opportunities that, if we leverage this technology, we can do a number of things, like, for instance, achieve speed. So AI algorithms can analyze medical images or data points in seconds, drastically reducing waiting times for diagnosis. We can also scale. So a single AI tool can be deployed across a country via mobile networks, offering specialist level analysis in areas that have no specialists. And you can also look at precision. So AI can detect subtle patterns in X-rays, in blood smears, or retinal scans that the human eye, especially when fatigued, might miss. And then there's also prediction. So by analyzing health data alongside environmental and population data, AI can help to forecast disease outbreaks before they become epidemics. AI doesn't sleep, it doesn't forget and can learn from millions of cases. In theory, it is perfect. It's a perfect health assistant, but only if it's trained well, tested thoroughly, and applied ethically. There are quite a number of use cases in Africa. I'll give you an example. In Uganda, we have malaria AI and cancer detection. There are researchers in Kampala at Makerere University's AI lab that are doing groundbreaking work. They have developed AI powered diagnostic tools that use smartphones connected to microscopes. They have AI scans of images of blood smears to detect and count malaria parasites. This is often a task that traditionally relies on a highly skilled but often overworked lab technician. Early results have shown a very, high degree of accuracy, and some labs are using this to analyze digital pap smear images for automated screening or cervical cancer, which is one of the leading causes of death for women in Uganda. In Tanzania and Kenya, they're using AI in radiology and diagnostics. At Aga Khan University, which has a major presence in Kenya and Uganda, and even Tanzania, researchers are building an AI model to detect tuberculosis by analyzing the sound of a person's cough recorded on a mobile device. And this This is a non-invasive tool. It can be a game changer for screening in remote or high volume settings, and this removes the need for costly and complex image equipment for initial checks. The this kind of solution or tool actually complements other work across the continent where AI is being used to read chest x-rays to screen for TB or even pneumonia. And if you look at Ghana and Nigeria, they're using AI in logistics and disease tracking. For instance, beyond this diagnosis, into logistics, there's a health tech startup called M-Pharma. It operates in 9 African countries, that is including, of course, Ghana, Nigeria, and they use AI to manage pharmaceutical supply chains. And its platform analyzes data to predict demand for specific drugs to help prevent stockouts in pharmacies and hospitals. And researchers in Nigeria are using epidemiological data and machine learning models to predict the spread of diseases like Lassa fever, helping public health officials to allocate resources and warnings more effectively. Closer to home here in Rwanda, we have Babylon Health. They operate as Babel, and they use an AI-powered chatbot for patient triage. Users can report their symptoms via mobile phone, and the AI asks a series of questions to assess the urgency of the case before connecting the patient to a nurse or a doctor. And the system has been really specifically localized for Rwanda, taking into account their local epidemiology and their language. But there are risks and ethical red flags that we need to tackle. For instance, biased data would mean biased diagnoses. And this is perhaps the most critical risk. An AI model is only as good as the data it is trained on. There are numerous studies that have shown that world class dermatology AIs trained primarily on images of light skin tones perform poorly when trying to identify skin cancer on darker skin. So, if the AI hasn't seen you in the data, it can't diagnose you accurately. This isn't just a glitch; it's a direct path to deepening health disparities. And then there's also the black box decision making. Many commercial AI tools are proprietary and they give a result, for instance, tuberculosis likely, but they don't explain how they arrived at that conclusion. There is this lack of transparency, and it is a major problem for doctors who are ultimately responsible for their patients. And it leaves patients with no way to challenge or even understand AI driven diagnosis. And also, you could also talk about data privacy and consent. Health data is our most sensitive information. As we digitize patient records to feed these AI models, urgent questions definitely arise. I mean, who owns this data? How is it secured? Are patients giving meaningful consent for their data to be used in training algorithms that private companies may profit from? And while Uganda, for instance, has the Data Protection and Privacy Act of 2019, there is research shows that the enforcement remains a significant challenge due to limited resources and, of course, low public awareness of data rights. And lastly, we could also think of exclusion by design. So AI tools are useless without the right infrastructure. So rural clinics often lack stable electricity, they don't have reliable internet. And so without a deliberate focus on creating offline fast and low cost tools, AI risks being another technology that will benefit wealthy urban private hospitals while completely bypassing the public healthcare system where it's needed most. So Building AI that serves and one that doesn't replace doctors, we have to think of AI in health must never aim to replace human care. It must aim to extend the reach of our doctors and nurses. And this is what needs to happen for us to achieve that. We need to build local with representative health datasets. We must invest in creating diverse datasets that include African skin tones, genetic diversity, and locally prevalent diseases. And this starts with digitizing local health records ethically. We also need to test and validate models locally. So if you build an AI tool that works in London, it must be rigorously tested and fine tuned to clinics in Gulu, in Mbarara before it can be deployed in those areas. And local doctors and clinicians must be central to this validation process. They have to be present. And also, we'll need to train the health workers, not just the IT teams. We need to empower the nurses, the midwives, and community health workers with the skills and confidence to use these tools. The focus should be on building trust and demonstrating how AI can support and not threaten their work, right? And also we need to strengthen regulation and oversight. So the government, academia, and the private sector must collaborate to create clear guidelines for ethical AI in health. That is, covering transparency, patient consent, and any safety protocols that need to be put in place. Now, as we come to an end of this episode, these are some of the takeaways. AI shows immense and proven potential to address critical health gaps in Uganda and across Africa, from faster diagnosis to better logistics. However, AI is only as good as the data and values that shape it. So, without deliberate effort, it risks amplifying biases and deepening the divide between urban and rural healthcare. And the path forward remains investment in local data, robust local testing, continuous training for health workers, and strong ethical regulations. So, if we want AI to serve the people, it must learn from the people. That is it for this episode of According to Wes. In our next episode, we'll explore the bedrock of it all, and that is AI and digital literacy. If people don't understand what AI is, how can they trust it, use it, or even demand that it serves their interests? So join us next week as we explore why digital literacy is the true foundation for an equitable AI future in Africa. Don't miss it. And as you listen to this podcast, wherever you're listening it from, on Apple Podcasts, on Spotify or YouTube, follow us, subscribe, and share it to your friends and network for them not to miss another episode or the episodes that we've so far recorded. Thank you and see you next week.